acne scarring can be such a big problem for many people. You've suffered with acne, you've got control of the acne, and now you're left with scars, whether that's ice pick scars, rolling scars, boxcar scars, or just post-inflammatory hyperpigmentation. All of them can pose their own challenges. And I've touched on just then the fact that actually what is important before you tackle your scarring is having control of your acne. There's no point in moving on to treating the scarring unless you've already got control of the active disease, because you'll just go on to develop more scars. But what are your options? I think if we start simply, skincare does help. Thinking about including particularly retinoids and maybe some gentle acids at home, so AHAs in your routine, can help to improve the appearance of scarring. But really, treatments are where we come into our own. Microneedling can be a great option for all these types of scars and across a course of treatment. So usually we're talking about 6 and sometimes even more sessions. And really being in the hands of someone who's an expert at microneedling helps, because some of these scars, the scar almost has a wall, and so microneedling at different angles can help to maximize the results we can achieve. There are some other treatments that can be really useful. So for example, using peels or laser. Now, with peels and laser, the results you can achieve will depend on the downtime you're prepared to accept. We can go from more gentle treatments that do improve the scarring and the texture of the skin to ablative treatments which involve significant downtime, but can also give significant reward, with the best results I've seen from treatment of acne scarring. And that can be done with either laser or chemical peel techniques in the hands of a true expert. It's important to remember both of these types of treatment, when we're talking about ablation, come with not insignificant risks. Even in those cases, when we go for such dramatic treatments, ice pick scars in particular can be really quite tricky to treat. And some of these deeper, more fibrotic scars are often quite tethered to the deeper layers of the face. So combining techniques, so laser with subcision, for example, which is where we use a very small blade or a needle to break up some of that tethering. And in some cases, it might even be beneficial to remove a scar using a skin biopsy technique and then stitching it back up again before resurfacing. And that can give a better result. So again, it really does depend on how far you're prepared to go to get results. And this is where expectation management is so important. With most of these techniques, we're talking about improving rather than getting rid of. Even when we come to ablation and using biopsy techniques, it's usually a significant improvement rather than a completely perfect skin tone thereafter. But the results can be truly life-changing. Last but not least, I'm going to touch on post-inflammatory hyperpigmentation or post-inflammatory erythema. This just depends on whether your natural pigment color is a bit more red or a bit more brown, but this is where you're left with coloured marks after the spot has healed. Oftentimes you'll find this will resolve by itself within a matter of several months, but you can help to speed it up along the way using topical skincare or lighter chemical peels, thinking about retinoids and ingredients like cysteamine or hydroquinone can be really helpful in bringing back a more uniform skin tone. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.